faculty orientations. We had two, one on Belknap and one on Health Sciences campus. We had one yesterday, so I want to thank Lee Botner, who organized that, as well as all the great work that Ashley did, Ashley Warner in our office, and Bailey Pulliam. So thank you all for putting together an excellent new faculty orientation. This is the second one we've had, second annual new faculty orientation with the focus on research. So I think it went really well. We had about 60 new faculty at those two meetings, really well received. So welcome your feedback on that. And hopefully we have some of those faculty on here today. We also are working hard on with our congressional delegation on getting some funding to the university through direct appropriations. We've had them on campus in the last couple of months, and we're going to be putting those in the next few months. So that work is continuing to progress, working with our congressional delegation to make sure that we're advocating effectively for the research here at UofL. And then Jessica Sharon's going to talk about a couple of funding opportunities that we have that are coming up, closing in the innovation space. So we've got a couple of innovation funding opportunities that are due very soon. So going to call those out. Jessica Sharon's going to talk about that at the end of the meeting. And then Lee Botner is going to talk about some internal grant opportunities that we have also at the end of the meeting. So with that said, I'm going to go ahead and see if Misty Hooper's on. Misty's going to talk about a health catalyst, the Cerner Learning Health Network learning tool that we have access to here at UofL. So Misty, are you on today?
Hey, Will, I'm on. I'm trying to share my screen here so that you all can see my slides. Just a second.
Excellent. And let me know. I can probably share them for you if you're having trouble.
Can you all see those okay?
Looks like they're coming through.
Yeah? Okay, great.
Yeah, we can see them.
So, good afternoon, everybody. Thank you so much for inviting me to this venue. We're very excited about some of the new opportunities that we have and are really hoping to build on our collaborations to bring some new opportunities to the university and to help our community. So I have several slides. I don't have much time, but I wanted to include the slides so that everybody who is on the distribution list would have basic information about what we do, who we are, and how to get a hold of us if we can help in any way. So you'll have more slides at the end, and I would just ask that you all would please forward those to your research colleagues and other folks and staff who may need some assistance or have questions for us. So I have our goal here. That's our published goal that has come down from leadership, and we're very excited about the leveraging that we can use across our health system for all of our patients, our clinics, our outpatient facilities, and hospitals. So we've been working as hard as we can to find a way and some solutions to give you all access to the data. So now my slides are not advancing. This is great. I might have to stop sharing and see if I can get them to advance.
Yeah, no worries, Misty. You could just kind of talk us through what your role is at the Health Sciences campus and at UofL Health, and then also maybe
just a few minutes to 1 minute.
Yeah, give us a little update on what the Cerner Health Learning Network is. And oh, there it is. We can see it now.
So the slideshow wasn't working. I'm just going to give you this view. Hopefully it's large enough.
That works.
So my role in research, to take a step back, I've been fortunate enough to be a part of the research community down here in the downtown Louisville Medical Center for, I'm in my 25th year now. So I love it. It's definitely, I'm very passionate about it. And I love the fact that we're continuing to learn and build on relationships and make new ones. And it's good to hear that you had 60 new faculty in an orientation. So we've been working with our marketing teams to kind of get our feet in that door as well, to help provide some, insight. So basically, all of the research that happens in the clinics and the hospitals and facilities that involves our patients, our patient data, or our staff, all that research has to come through our office. I'm the director of that office, and we have to issue an approval in addition to whatever IRB or IACUC approval that you may have. So we have that role in oversight, but we also, when we're dealing with the community medical group physicians, we have an extended role with some of that administrative paperwork that can't happen on the university side because of the gratis appointment. So, and there's more information on those at the end of the slides. So I wanted to start with the Cerner Learning Health Network. We are one of several hundred hospitals across the country that use Cerner as the EMR. And so we have now executed the contract. The Cerner people are working with our IT department to upload all of our data into this data set. And the Healthy Data Lab is the repository that is hosted on Amazon Web Services, and it has about 8 years of de-identified data that can be used for research purposes. So we had been working through this process to get us to this contract stage with other faculty members at the University of Louisville who have since moved on to different facilities. So now we are piloting our first access with some of the Speed School and Dr. Huang, who is very interested in AI. So you can look at the slide and see there's a good mix of urban and rural and teaching hospitals. It was in June was the last update for some of those slides. They had about 44 states. It's very powerful data if you can figure out how to use it. And they one of the caveats is that you can't export the data from the system. You have to work inside the system. And so they have several tools that are listed there that you can work within to get all of the charts and summary data that you need, and then those could be exported for publications. So on this slide, I've included the link that Cerner had given us with some of the examples of the journal articles that were submitted and published through this process. They have told us that it takes about at least a year or so for the people who've been using it to really understand the data set, to know how to get what they need out of it. So we get 3 free users with our contract that UofL Health has with Cerner. And then there's a correction on this slide from the one that I had sent before. I received clarification that the $1,600 is a monthly fee per user. So what we plan to do is use the 3 user licenses to rotate those in and out as requests come through. And then we'll be looking, to you, Will and Kevin, and to leadership to help us determine and prioritize, what's the highest priority, or if we need to look at trying to fund additional users. So this is very exciting for us. I'm not sure quite how long it's going to take to get our own data in Cerner. Right now, all the other data is in there stood up, but they're working to get ours in there still. Does anybody have questions on that? I know I kind of went fast.
Yeah, Missy, that's great. Looks like Dr. Gansel has a question.
I was wondering, and I like to lump instead of split, but if the current users is UofL Speed School, why could we not have another user be the UofL School of Medicine? And then that way, not just Department of Anesthesiology, but all departments could have access to that. Am I just being too optimistic?
Well, we asked this question, Dr. Gansel, and they said it's definitely best practice to have individuals tied to a user account. So I can explore that more, and then also work to see what our other options are to get additional users.
Okay.
Yeah, that's
Thanks.
a good question. And I guess I should say, if there are other members in this meeting or new faculty who would like a presentation of this from our Cerner colleagues, they're happy to do that. So I've scheduled several of those over the last year and a half or so, and happy to do that if someone wants to give me some more names, then we can go that route. The second thing that I wanted to talk about is our Health Catalyst system. Some of you all may have already been in discussions with this tool as well. This is our data repository. So this software platform allows us to pull in all of the data from every system across UofL Health. So it includes our financial data, the PACS data, the pharmacy data, the Cerner, Epic, all the subsystems across all the facilities, and it pulls those data tables in, and so that is how we are trying to get our own local data in a way that is more usable, and then also to get the access to the university researchers who need that. So right now, there's about 3 million patients of data that's in there, and we have filters that we can use by diagnosis, providers, facilities, all sorts of options. It's very user-friendly to get raw data. Currently, we're using this. We've been using this in the research office for, I would say, about a year and a half, when researchers ask us for data to get pilot submissions ready, how many cases and what diagnosis and what time frame, what facility. We go in and run those queries very quickly, and we can give that data for preparatory to research. The other thing that we started doing very early, especially with COVID, we can build reports that pull from that data set every day based on values and other parameters that are set, and then we can email those out securely to the researcher to help with their screening activities. And then we have a lot of nursing research and pharmacy residency program that we support in our office, and they just need large data sets, and so we can go in there and put in the filters and the qualifiers and pull those sets of data and get those over to the researchers where they need to have them. We've also established the SharePoint site. That's the location, I guess, where our IT people have agreed that we can put data there, and both sets of people can go work on the data, and they have their own secure location and files that are set up through our office. That seems to be working well for those cases where people on both sides are working together and need access to the same data. For the Health Catalyst, we're currently exploring the option of getting access to the School of Public Health, the School of Medicine, to the people who really need the raw data and have their own methods to do the analysis. And so we had an agreement that was agreed to with previous leadership. That is currently being vetted again, and more to come on that. I'm going to keep pushing, trying to get a solution, since we're definitely working together and want to collaborate. So it's kind of a holdback at this point that we're hoping to overcome soon. Do you all have questions on the Health Catalyst?
It doesn't look like it, Missy. It's a great tool, though. Thanks for sharing about that.
Okay. So the next slides, again, are just really talking about our team and roles that we play and how to get us on our webpage. And seems like as soon as I start to share, it's taken away my ability to move slides along. But you all can look at those later. I don't want to take any more of anyone's time. I have the IRB meeting to jump onto, but feel free to reach out to me or any of our service accounts. And here's our webpage. And then, I look forward to your feedback and let us know how we can help.
Well, Misty, thanks so much for that presentation. Hopefully that tool with Cerner will be useful to some folks on the call. And like you said, they can always reach out to you directly or through our office to help facilitate that connection and get access to that health data, which I think could be very powerful for a lot of researchers across campus. So up next, we have Betty No, who is the editor of the undergraduate journal, the Cardinal Edge. So Betty, I'll turn it over to you and give an update on the latest edition of the Cardinal Edge.
Thank you so much. Hold on one second. I'm going to share a screen. Please let me know if it works.
Yeah, that's working.
Okay, great. I'm going to leave it like this just because I think sometimes it gets finicky when you try to go in presentation mode. But hi, everyone. Like William had mentioned, my name is Betty, and I am an undergraduate senior. I'm here to talk a little bit about the Cardinal Edge, which is the University of Louisville's sole multidisciplinary undergraduate research journal that I had the pleasure of co-founding back when I was a freshman in 2019. And I served as the editor-in-chief for the past couple publication cycles, in which we released our second issue back in September of 2022. So again, I'm really excited to have the opportunity to promote our mission and vision, to discuss to you all about how the Cardinal Edge plays a unique role in uplifting undergraduate research efforts. And of course, I'm happy to hear your all's feedback. Yeah. So first off, what are benefits for undergraduate students to decide to author with the Cardinal Edge Research Journal, and what are benefits to undergraduate students who are interested in joining our journal staff? So the Cardinal Edge is in partnership with the University of Louisville's libraries institutional repository called ThinkIR. And so this allows us to provide an open access journal. So for individuals who are hoping to read papers that are published to the Cardinal Edge, they can do that with no cost, no barrier. And for undergraduate students who are looking to author a paper and publish their paper, ThinkIR allows us to have a platform that is completely free at no cost, no barrier, to engage in the entirety of the academic publication process. So benefits to undergraduate students who are looking to author. This is a really great opportunity to write a manuscript on an original research report or first author in paper and engage in the entirety of the academic publication process. A lot of undergraduate students who submit to the Cardinal Edge, it is their first manuscript, and they are involved with the process from initial submission to the review process with faculty reviewers, and end up at the final decision, which is hopefully acceptance of their paper into our journal. Benefits to journal staff is our journal staff is able to engage in the publication process to its entirety. So undergraduate students are getting the opportunity to serve as editors on the back end, and to facilitate the relationship between author and reviewers. A lot of our journal staff are also able to connect with faculty on campus whenever we're doing promotions and talking to faculty about potentially serving as reviewers for relevant papers. And we are also a network with about 50 or so undergraduate research journals across the US. The Cardinal Edge is now also offering course credit for students who are interested in being part of our journal staff. So this looks like biology 390 credit, which is an elective credit. So a little bit more about our second issue. Again, this was published in September of 2022. We received 28 submissions in total and ended up publishing 19 submissions. The Cardinal Edge is accepting of about all manuscripts. So brief research reports, abstracts, full-length research reports, and even literature reviews. So WR classes, that midterm, that final paper are very conducive to the standards of the Cardinal Edge. So we really encourage students who are involved in WR courses to submit to us as well. We also have something called spotlight articles, which are papers written by our staff, and our staff searches for research endeavors on campus, and then we write our own articles about them. And so I know that for this 2022 to 23 publication cycle, our spotlight team is working on a paper about how about the science of learning, so how faculty are engaged in active learning in the classroom, how students best learn. So that's something that we're working on and is unique to UofL's research culture that we push out on the Cardinal Edge. A little bit about our readership. As of yesterday, this is across our first and our second issue. There have been about 5,800 downloads and 4,000 abstract views. There have been 5 mentions, and one that I want to highlight is one of our papers was, I guess, mentioned or cited in a CNN Health article. So this was something huge for the author of that paper. This paper is about sexual misinformation, sexual health misinformation. And this was a big win for that author. And it was also a big win for us as the Kernel Edge Research Journal. So how can you get involved as faculty, as people who are interested and supportive of our mission and vision? So I'm so grateful for the past few years that I've been involved with the Kernel Edge because we have seen broad scope support of our endeavors. And so every year we go on a big solicitation for undergraduate students to submit their original research, their literature reviews, and what they think is conducive to uplifting TCE's mission. So we always encourage faculty to encourage their undergraduate students to submit to us as well. We're also always in search of faculty reviewers who maybe want to review papers that are relevant to their field and expertise if we were to receive a submission in that field and expertise. And then we also would love your involvement in our different outreach events. So in the past couple of years, we've hosted panels, roundtables, etc. And I know that in the next month or so, we're having a Pasta with Professors event, which is more of a casual roundtable event for students who are interested in undergraduate research to talk to faculty that are interested in sharing their research with undergraduate students and maybe getting them involved as well. So a little bit about our operations. The Kernel Edge operates in 4 cohorts: outreach, review, design, and spotlight. And they all have their own operations that aim to uplift our overall mission statement of bringing forth a narrative of research from the undergraduate student perspective. So outreach and design are pretty self-explanatory, but our review and our spotlight team I would talk a little bit more about. So our review team is more of what you would say is the editor role. So our review team are the people who check submissions. They solicit for reviewers, which are often faculty and grad students. And now we're also soliciting past authors to also review our relevant papers. So review team is more working in that editor role. And we also have the spotlight team that, again, writes articles highlighting unique faculty and student research efforts at UofL. A little bit more about our journal staff organization. We are a entirely student-run journal. And so we currently have 28 undergraduate students who run our journal, with a majority of them being freshman students. So we have about 13 first-year or freshman members this publication cycle. Because we have a lot of staff members that are graduating, like juniors and seniors who are looking to leave and move on to different things, we focus a lot on our underclassmen journal staff members, and able to cultivate them into bigger leadership positions. And so for the past couple years, this has pretty much worked. We also have advisors currently in the biology department, Drs. Mark Running and Dr. Shira Rabin, and also Dr. Brian Robinson in the JSB Speed School also showed interest in being part of the Kernel Edge. And if you are interested in also being a liaison or being someone that spreads forth what we are engaged with, I would love to be able to talk to you as well. And a little bit about future steps for me to close up. So the Kernel Edge is working on retention of our staff and also our submissions. As noted, we had about 28 submissions and then 19 were published. So some of the loss of submissions were due to authors, not responding to us, or authors not meeting deadlines. And so we're working on being as quick as possible with our operations and our review team. We recently are in collaboration with the Center of Engaged Learning. It's actually the office that I'm in right now. And so that has really been a centerpiece for us, because now we have a physical space to promote the undergraduate research journal and a place where students can come in from the Center of Engaged Learning to learn more about us and to hear from our journal staff who are engaged in a wide variety of research efforts and backgrounds and majors, and hear from an undergraduate student how to get involved and the importance of undergraduate research. And lastly, we're also, of course, looking to increase our visibility on campus. With right now, we have a current focus on spreading our mission statement and vision with the Speed School. Last semester, we did our first round of solicitations and promotions in the introduction engineering courses. And so again, we're hoping to find faculty and undergraduate students to join our team and promote our mission and vision as well. All right, that is all I have. And I don't want to take up too much time, but if you have any questions, and I will also link our submission portal and our website in the chat here, and also my email. So please let me know if you have any questions or any other comments. We're really receptive to feedback as well. Thank you.
Well, thank you so much, Betty, and congratulations on the publication of your second edition. Yeah. And yeah, I look forward to seeing that link. So that's where they can get access to see the edition, right, on the website. Excellent. All right. So up next, we have Dr. Chitalia. So Yash Chitalia is a new faculty member in mechanical engineering with a focus on robotics, medical robotics, and especially micro surgical robotics. So he's going to give an update on his research, what he's focused on, and hopefully identify some new collaborators in surgery. So, Dr. Chitalia, I'll pass it over to you now.
Thank you, Will. Can you hear me and can you see my slides?
Yeah, it looks great. We can hear you fine.
Great. Like Will said, I am a new faculty here in the Speed School of Engineering, and today I'll be talking about my previous and ongoing work and a little bit about future work on designing extremely tiny surgical robots. A little bit about me, like William said, I joined about 4.5, 5 months ago, and I come here from the Boston Children's Hospital and Harvard Medical School, where I was working on the design and mechanical modeling of cardiovascular and neurosurgical robots. And before that, I was at Georgia Tech, where I also worked on the design of microcatheters, some of which I'll talk about today. What I'm doing here is I will be leading the healthcare robotics and telesurgery laboratory. We're located here in the Shoemaker Research Building, 213 and 215. And we have a bunch of cool robots that we'd love to collaborate with some of the audience with, if possible. So with that, let me begin with a brief sort of breakdown of what I've done in the past that is kind of representative of my research even here at the UofL. The first area of my research is the development of a microscale robotic guide wire, which is a type of microcatheter. And the second is a slightly larger mesoscale endoscope for neurosurgical applications. In my previous work, I've worked on the design of both of these scales of robots, mechanical modeling, and the control of these robots. Control in order for these robots to be intuitive and to be easily incorporated into surgical workflow. So with that, let me begin with kind of the first area of my research. To all the health professionals here in the audience, you already know, but cardiovascular disease is just the leading global cause of deaths, right? It exceeds, in fact, the number of deaths from cardiovascular disease exceed those from all types of cancers combined. About 20 million people die from these every year. And minimally invasive treatment or endovascular treatment of cardiovascular disease is gaining prevalence in recent times, and it's associated with lower trauma to the patient, shorter hospital stays, lower risks of mortality, so on, right? Now, what happens is often for cardiovascular diseases, clinicians make use of this long and thin wire known as a guide wire, which is a type of catheter, a microcatheter, to go from a suitable insertion point, for example, the femoral artery or the femoral vein in the leg of the patient, all the way perhaps to the heart to treat a blockage or to repair a heart valve, or in the case of a disease called peripheral artery disease, the clinicians will often use this guide wire to go from one artery in one leg across, turning almost by 180 degrees to the other artery of the other leg to treat some sort of a blockage. Now, manual navigation of a guide wire, to all the clinicians in the audience, you already know this, but manual navigation of a guide wire is a very time consuming and challenging endeavor. In fact, it's very similar. I like to give this analogy, but it's very similar to a plumber and a plumber snake when the plumber is trying to treat a blocked drain, but the drain is a mile away, and the only control they have in their hands is the base of the snake, and they're trying to clear a blockage that's a mile away, right? And that's how it looks like when clinicians are using and trying to navigate this guide wire to a target blockage. And so here's sort of a brief video from the BBC, which kind of explains what a robotic guide wire needs to do, right? What we need is not a plumber snake. What we need is a real snake. And the key distinction is that in biology, when a snake moves, you can see the body of the snake kind of follows the head. In continuum robotics literature, we call this motion follow the leader motion, where the body of our robot needs to follow the head for us to really be able to utilize this steering capability in robots. So to address the challenge of being able to manually navigate a guide wire to a target region, we designed this robotic guide wire, which we call the coaxially aligned steerable robotic guide wire, or the COAST guide wire. And this guide wire, the key feature was that its outer diameter was only 0.4 millimeters. So to give you an idea of how small that is, that's about the thickness of 3 or 4 of your hair. So it was extremely small, and that's about the order of existing guide wires on the market. So by designing it at those scales, we were able to kind of achieve the dimensions that are currently being used in the OR room. Now, the key feature of this design was that it featured a completely variable and controllable bending joint angle. And you can see here the robot can control its own angle, but it can also control its own length. And that is what allows it to do what we call this bio-inspired follow the leader motion. And you can see that on the slide very clearly here. You can see the guide wire is being advanced towards this coin, but more importantly, the body of the robot is following the head. And when it goes back, the head follows the body. And you can see here in the next part of the video, this follow the leader motion can be executed at very, very tight angles of even 180 degrees. And here you can see when we're going back, the head kind of follows the body, which is very, very important when you're trying to make these 180-degree turns around, for example, the aortic bifurcation in cases of peripheral artery disease. So then how do we use this guide wire, right? So this slide might look very, this slide might look very hairy, but it's essentially the controller that drives the robot to perform these trajectories. What we do is we get CT data from the patient, anonymized CT data. We convert that into a model, an STL model, that then can be analyzed to get center lines of the vascular structure. Once we have the center lines of the vascular trajectory, we can generate a plan for the robot, a trajectory for the robot that it can then follow and execute this follow the leader motion. So here on this slide, you can see this trajectory being generated for the aortic arch to the left and the aortic bifurcation to the right, where the trajectory is kind of going from one femoral artery up into the aorta. Now, once we have this trajectory generated, right, we were able to demonstrate our ability to perform follow the leader turns for the first part of this aortic arch. You can see that here. We are visualizing with a C arm for for a phantom aortic arch from a real patient, and the same for the aortic bifurcation. Here you can see we're going in through the femoral artery. This is obviously a 3D printed phantom prototype, but here you can see by actuating the degrees of freedom of the robot, we can make these tight turns in a very sort of bio-inspired fashion. So now I'm going to switch really quick to the second area of my research, which is a little larger, which was a neuroendoscope. The target application for this was a condition called pediatric hydrocephalus. Now, this condition occurs when there is some sort of accumulation of a fluid in the patient's brain known as cerebrospinal fluid. So this fluid accumulates and builds pressure on the brain. And if untreated, this condition can be fatal. It occurs at a rate of about 0.4 to 3.2 cases per 1,000 births here in the US, but the rate is even higher in developing countries. Now, minimally invasive treatment in the form of a procedure called endoscopic third ventriculostomy, or ETV, or choroid plexus cauterization, or CPC. These are minimally invasive treatments that are being applied to treat hydrocephalus. So, for example, in ETV, what the clinicians do, and you can see this video to the bottom left of your screens, the clinician goes in through a single bore and makes use of a rigid tool to make a perforation at the floor of a chamber in the brain called a ventricle. In this case, it's the third ventricle. The clinician makes a hole, and this allows the excess buildup of fluid to be drained out of the ventricle, thereby relieving pressure from the child's brain and treating this condition. Now, for both ETV and CPC procedures, in fact, every procedure, clinicians make use of rigid tools that are passed through rigid trokers, like you can see in this image to the bottom right, right? And so we designed a robotic version of this neuroendoscope in collaboration with our neurosurgeon collaborator at Emory. We identified major requirements of such a proposed tool. For example, here from CT data, we were able to design a tool that was able to cover the entire workspace of the ventricle, which is obviously very critical when we really want to target different points in the ventricle, for example, for cauterizing choroid plexus, or to perform ETV at a site that is not necessarily reachable by rigid tools. So we identified many requirements. Of course, the robot we designed had to be easy for the clinician to use. You can see here Dr. Churn is using our robot here, and it's very, very sort of compatible with his current surgical workflow. So with that, here's a brief sort of video of the robot in operation. It had 2 degrees of freedom, or 2 joints, and so it was able to make these sort of S-shaped curves, which allows clinicians to kind of triangulate on a target site, especially if they're using more than one tool. I'm going to quickly show a demo of this robot in operation. We already saw here in the first slide clinicians making a perforation with rigid tools. Here I'm cauterizing this phantom brain. It's a fake brain, but the cauterization is just to show that currently clinicians can only cauterize a certain target site or a very small workspace. But then by being able to actuate the 2 degrees of freedom in a very sort of ergonomic fashion, clinicians can target these areas in the ventricles that otherwise wouldn't be reachable at all. And here you can see the clinician will sort of actuate the 2 degrees of freedom here inside the ventricle. And then using that, they can still visualize the whole workspace, but they can go in and cauterize targets that are otherwise not reachable. All right, so in summary, what do we do well? We're doing similar tasks here in our laboratory, the Heart Lab at the UofL as well. In summary, we can design extremely long and extremely thin robots that can snake through tiny vessels, tiny lumens, arteries, veins, and things of that nature, can navigate inside the heart, for instance, inside brain ventricles, inside even heart tissue. And we can also avoid critical structures because of the joints we have in it. But more importantly, What we're currently exploring is, for example, using our robots for in vivo diagnostics. For example, having sensorized tips on our robots so that we can have like a a laboratory on the tip of our robots where we can sort of diagnose conditions in vivo by sending the robot through natural orifices. We're looking at targeted cancer therapy for cancers that have basically spread to other organs from where they originated. We're looking again at cardiovascular neuro applications similar to the ones you saw on the slideshow. We're looking at 3D printable robots. I see some 3D printing experts here in the audience. So most importantly, we're interested in your ideas. We're interested in collaborations. We want to hear from you. So if you have any questions, feel free to reach out to me at that email address on the bottom of the slide. My website is linked there too, and the QR code on the slide also. I'll keep the slide open, but that also points to my research. So you can take a look, see if it aligns well with what you have in mind, and feel free to reach out. Thank you.
Yeah, thank you so much, Yash. That's a fantastic presentation and great work. And welcome to UofL. Really excited to have you here with us.
Thank you. Thank you.
Hopefully you get some good contacts from today.
Mhm.
So yeah, feel free to reach out directly to Yash or reach out to us if you want to connect in any way. So if there's no questions about that work, we'll move on. Lee Botner is going to give an update about our internal grants as well as the updates to the NSF BioSketch that are coming and what that means for people who are submitting to the National Science Foundation. So Lee?
Thanks, Will. I just wanted, like Will said, to sort of talk a little bit very briefly about the timeline for our upcoming internal grants. Previously in the spring last year, we offered 2 programs and funded, I believe, a total of 25 faculty and had been interested in doing 2 other grant programs in the fall, but for various reasons was not able to. So I'm very happy to report that this spring we're going to run 5 different programs. The goal is for us to get all of the internal grants and the application requirements into our InfoReady platform by the end of next week, and then to disseminate information to the campus with more details and how you can apply. And so what I've put here is sort of the 5 different programs. We're going to repeat the programmatic grant program that we had run last spring. That one provides up to $3,000. And we're really interested in, funding faculty that have challenges with trying to get research funding outside of the university. Often these are really helpful to people in the arts, humanities, and social sciences, very broadly defined, but anyone can apply. So we're not restricting it to those categories. We're going to make that deadline be at the end of February 23rd. And so what I've listed here is just sort of some dates of how we will conduct the review, and then project start dates for that one would be in April. We're going to run the same program that we ran last spring for the John Rieger Seed Grant. This year, we are working in partnership, with the Office of Undergraduate and Creative Activity, I think is their title. And so we've been able to increase our funding slightly for that. This one is open to early career faculty. And the work should lead to the submission of a proposal to an external agency. The goal also is to include an undergraduate student and, if possible, a graduate student. So we're going to make that one be due March 9th, and then projects will be funded effective May 1. And then we're really excited about the next one, which is the Research Collaboration Program Grant. And this is a brand new program that we are piloting this semester. The thanks to the efforts by Michael Menz and Mira I never pronounce her name right, in the College of Ed, I don't know, somebody correct me. Mira, I apologize. The idea here is that we will convene and have 2 different networking events on campus where we will match faculty into tables that will include faculty with similar research interest or who have indicated they're looking for someone in a certain discipline to help as a collaborator. And then we'll do a facilitated discussion in both of those events. And at the end of that, any of the participants that are part of that program can then apply for a small grant of up to $3,000 that can be used for further planning meetings if that's necessary, or to work on getting some preliminary data. But the idea is to continue to foster a collaboration by those teams that sort of form through the networking event. Those will be open to the entire campus. We're really going to target, early career researchers and clinicians that are, really trying to look for collaborators on campus and make some connections. So that one will be brand new and will be posted. The project periods for that one will also start in May. And then we're going to host our collaborative mentoring grant that will provide funding up to $10,000. And this one is really a collaborative project that's being pitched by an early career faculty member or early career researcher that has identified a mentor. But just as importantly, not only someone who can mentor them that has potentially received external funding, but then who is also interested in working on a joint collaborative project. So that one's different from the one that I just discussed because these are really, trying to identify mentors that they can work on things, as a group. The next one is the capacity building grant. And this one is funding up to $25,000. And then we indicated there could be some in-kind support from my office. And what we're sort of looking for here is anyone on campus that is already sort of established an interdisciplinary team that goes across 2 or 3 colleges, but really needs some support for some, maybe some planning retreats, for getting together of the team over, pizza or whatever. And then also giving them some funding if they need a student to help with, web development for the team or to get preliminary data. But then, the goal is for that team to identify a funding opportunity that they can go after built, on this team that has come together. And then at that point, if there is any type of thing that we can support in our office, and we're talking about things if you need help with editing of the proposal as you're building it and developing it, if you need someone to help with graphics, to make it very professional and very, very competitive looking to the sponsor. And all kinds of things that we could talk about, project management, if that's what you need. So that one, just simply because we really want to spread these out so that we have the bandwidth to find reviewers for each, but then also, have the support in my office to sort of administratively manage these. So those will be due at the April 24th, and then the project period will start June 1. So those, and I'm going to share this Excel sheet, and I've also included on the second tab the descriptions. It's just that the first tab was really starting to get a little busy, so I sort of broke it up. The other thing I just wanted to sort of talk about, and we can talk about the new requirement for the NSF Science CV BioSketch. as we go. But we do have some upcoming professional development opportunities that are targeting faculty. And so again, these will be disseminated out with registration links, hopefully by the end of next week. And all of these we're working, these are not going to be professional development opportunities that we are hosting. These are being co-hosted. What I really would like to encourage any of you to do is, if you are offering some sort of training within your department or your college or school or institute that could benefit a broader, campus audience, please reach out to me and we can see how we can jointly start facilitating more opportunities for learning and growth of faculty. So the first one I put here is in collaboration with the Speed School, who has had a very successful program that they have facilitated for several years around faculty that are interested in applying to the NSF career program. Excuse me. So the first workshop that will, it's not workshop, first session will be on February 1. It's on the UofL event calendar already. That'll be from 12 to 1. It's virtual. And if you have any questions, you can talk to Jackie Smith in the Speed School. This year, we did also work with the College of Arts and Science, who will be including, the panel will have UofL awardees that are from not only Speed, but also the arts and sciences. The second one here I wanted to highlight, we have talked before that we have the funding opportunity database that is powered by Pivot. And what we're doing in collaboration with the College of Ed is to have Cecilia Peridot provide a really robust advanced training on Fund Finder. She's done this for faculty within her college and has sort of really done a great job of coming up with, how to navigate some of the nuances of the database. So we will be offering that for the entire campus. The date has been established. It'll be February 10th from 1 to 2. It'll be virtual. And then we will do a NIH data management. I think all of you that are, seeking funding from NIH are probably aware that as of yesterday, NIH now requires a data management plan. So thanks to Dr. David Scott in the School of Dentistry, he invited me to a data management session that he had pulled together that was presented by Danny Laprise from the Kornhauser Library. And it was so well done. I really felt like that it was something that the broader campus would benefit from. So she has agreed to host a session on February 22nd from 11 to 12. We would prefer to have a hybrid version of that one, but we need to see if we can find space. So sort of stay tuned. If we can't find space for in-person, we will definitely do it virtually. And then the last one, and sort of ties into the other subject that Will was talking about. If you are a researcher that applies to the National Science Foundation, I hope you are aware that in the latest policy guide that came out in January, it announced that they are mandating as of October of this year that all biosketches and current and pending documents must be created through a platform called Science CV. Science CV has been around for years and years. And I think it started with many people from NIH trying to use it. The bottom line, it's a very clunky, hard to navigate tool. But most importantly, getting the information that needs to go on your biosketch, as well as current and pending, is very time consuming. So I'm working with several people on campus, including Wayne Ling, who I think is also going to be talking next, about ORCID. We are planning to do some trainings that we will announce probably mid-February. Right now, NSF did do a webinar on, I think it was January 19th, that talked about the tool. And in that presentation, they indicated they've already identified some kinks. So I really feel like we need to give NSF a little bit of time to iron out those kinks before we start, rolling out some training. Our thoughts currently is that we will obviously invite any faculty researchers that would like to learn the tool, but we are also going to target any people within your lab or a graduate student or a research assistant, whoever you believe might be able to assist you, because there is a delegation tool. And so we really feel that because it's going to be time consuming, and faculty, we all know that you're already very, very busy. So we just want to make sure that we get that out. And then one last thing, Will, I see you jumping on. We are doing a planning and writing successful NIH grant proposals. We're using an outside external provider training group, and that save the date should be May 16th. That'll be in person, and again, it'll be open to the entire campus.
All right.
If
Thank you so
anybody
much,
has
Lee.
any questions, just let me know.
Yeah, that's right. And all this information is going to be coming out in a variety of ways on the website and emails, et cetera. But yeah, I just wanted to give Lee to have a little bit of time to tell you in person. So Lee, thank you so much for that update and all the great work that you're doing there. Wei Ling, we'll skip you this time, given the amount of time we have. We're going to have that session that Lee mentioned around ORCID and the training tools for ORCID. So I just want to leave a minute or two here for Jessica, because we've got a couple of funding opportunities that are really, the deadline's coming up really quickly. So Jessica, will you please give us a quick call out on those innovation grant funding opportunities?
Yes, I'll go as fast as I can, and I just put some information in the chat for everybody. So the I-Corps program, this is funded through the National Science Foundation. We are in a period where we are transitioning as U of L from an I-Corps site to being part of the Mid-South I-Corps hub, working with Vanderbilt University and collaborators across Tennessee, Mississippi, and Virginia. So very excited about that. But for you to participate in this and to get some funding to support entrepreneurial training, customer discovery, and prototyping to support customer discovery, very important distinction from the NSF there. The grant deadline is tomorrow. I will say if you have an issue, we might be able to extend that until early next week if you'll send us an email to icorps@louisville.edu. The other one that's currently open is our Kinetic program. This is funded in collaboration with the University of Kentucky and all of our regional universities across the state. This provides a 6-month grant of $40,625 to support product development for products to address unmet clinical needs, so for human health. The deadline for the 2-page pre-application is February 13th. I put the email address for our team there. We've got a team of project managers ready to help you with your pre-application, answer any questions along the way. So feel free to reach out. Hope to see lots of folks apply there.
Excellent. Well, we got it in under time. So thank you so much, Jessica, and to all of our presenters today. Great job. I really appreciate your time and everyone's time this afternoon. And we'll continue to have these. So everybody have a great rest of your week. Bye-bye.